There is a moment many people recognize, but almost nobody talks about. You are sitting at your favorite restaurant, your coffee arrives, you reach for the cup, and your hand begins to shake, not a little, enough that you notice it. The person across from you says nothing, but you see them look. You grip the cup tighter. You take a slow breath. You hope nobody saw. But later that night, alone, you think about it. And you wonder, is this just getting older? Or is something wrong with me? If that moment feels familiar, please keep listening. My name is Dr. Sayal M. Rubo, and today I want to have an honest conversation with you about something millions of people are quietly living with and quietly worrying about: shaking hands. Before we go further, try something right now. Pick up any small object near you. Hold it straight out in front of you. Watch your hand for 10 seconds. Is it completely still? Or does it tremble? If it trembles, drop a comment with the word tremor right now. I want to know who is here today. Let me tell you about a woman named Patricia. Patricia is 66 years old. She was a bookkeeper for most of her life. Careful, steady, precise. But about a year and a half ago, she started noticing something. When she poured her morning tea, the spout rattled against the cup. When she signed her name, the letters came out shaky and uneven. She was scared. She thought it was Parkinson's disease. She went to her doctor. Her doctor looked at her hands carefully and asked her one simple question. Does your hand shake when you are moving, or when it is just resting still? Patricia said. When I am moving. When I reach for things. When I write or pour. Her doctor nodded and said, Patricia, this is not Parkinson's. This is something called essential tremor. And for the first time in over a year, Patricia felt relief. So let me explain the difference simply, because this one difference can completely change how you understand what is happening to you. Essential tremor happens when your hands are in use, lifting, writing, pouring, holding objects. Parkinson's tremor happens when your hands are completely still and relaxed, just resting in your lap. Essential tremor usually affects both hands around the same time. Parkinson's usually starts on just one side. Essential tremor can make your head nod or shake slightly. Sometimes even the voice trembles. Parkinson's rarely affects the head in the early stages. And most importantly, essential tremor does not cause stiffness, slowness, or balance problems. Parkinson's disease does. So if your hands shake when you reach for something, but feel fine when resting, that is an important piece of information. Now let me tell you what scientists found about what is actually happening inside the brain. Deep inside the back of your brain is an area called the cerebellum. Think of it as the part of your brain that controls smooth, steady movement. Researchers recently found that in people with essential tremor, specific brain cells in the cerebellum, called Purkinje cells, slowly begin to weaken over time. These are the exact cells that tell your hands to move smoothly and steadily.
When these cells are damaged, the signal gets unsteady, and that unsteadiness is what you feel as a tremor in your hands.
It is not weakness. It is not nerves. It is a communication problem inside a very specific part of your brain. Now, here is a simple test you can try at home tonight. Take a pen and a piece of paper. Draw a spiral, starting from the outside and slowly moving inward. Take your time. Try to make it smooth. Now look at what you drew.
Are the lines smooth? Or do they look shaky, like a regular wobble you could not control even when you tried?
If the lines look shaky, that drawing is important. Take a photo of it and show your doctor. Let me also share what can make tremors worse, because many people are making their tremors worse without even realizing it.
Exhale sharply. Too much coffee or tea every day. Caffeine makes tremors stronger.
High stress and worry. When your body releases stress hormones, your hands shake more. Not sleeping enough. Your brain needs rest to control movement properly. Poor sleep makes tremors noticeably worse. Certain medications. Some common medicines, certain breathing inhalers, thyroid pills, and mood medications can cause or worsen tremors. Many people never connect this to their symptoms. Always ask your doctor to review your medications. Now, what actually helps? There are two medications that doctors have used for years to reduce tremors. One is called propranolol, and the other is called primidone. Both have strong medical evidence behind them. They work for about half to two-thirds of patients who try them. And here is something exciting that happened very recently. A brand new medicine called ulixacaltamide was just submitted to the FDA for approval in early 2026. This would be the very first medicine ever created specifically for essential tremor, not borrowed from another condition. In clinical trials, patients who took it saw real improvement in daily activities like eating, writing, and holding things steady. That is genuinely hopeful news for millions of people. For severe cases, there is also a non-surgical procedure using sound waves that targets the exact part of the brain causing tremors. It is called focused ultrasound. No cuts, no surgery. And it has helped many people significantly. Here is what I want you to remember from today. Shaking hands during movement are not automatically Parkinson's disease.
Shaking at rest, when your hands are completely still, is a different warning sign.
Head tremor and voice tremor are more common with essential tremor than with Parkinson's. And new treatments are coming, better than anything available before. The most important thing you can do right now is stop guessing and start talking to your doctor. Tell them exactly when your hands shake. Show them the spiral you drew tonight. Ask them specifically about essential tremor. You deserve a clear answer, not years of quiet worry. If today's video gave you clarity, comment the word informed right now.
Share this with someone whose hands shake and who has been told for years it is just old age.
And follow this channel, because next time I will show you the 7 warning signs that your body's balance system is starting to fail, and what you can do right now before a fall changes everything.